Hey, welcome back to Light and Love. It's me, Kira. Glad that you can stop in with me today. Come a little closer. I want to talk to you. A little bit of serious information, sharing some light and love with you today. You know, this week I've been listening to the news and we've been talking about the coronavirus, which of course is what's happening all around the world. And this week they made mention as to the numbers that they've been seeing in the deaths, or let's say people that have been succumbing to getting sick from the coronavirus. The numbers have been representative in some manner to show that people that look like me, a person of color, African American, if you want to use that term, black, but people of color are succumbing to this disease in higher numbers than they knew anything about. So I wanted to talk about that today because, they talked about how we are already predisposed to high blood pressure, diabetes, asthma, the list goes on, and how having those underlying conditions makes us a target in some way for this virus. So let's just jump into it because it's such an important thing that's going on that I want people to understand how it's affecting everybody in this world and how I believe that we can somehow control some of the things that is on our predisposed list. Let me tell you, like with my mom. My mother has had diabetes, I want to say, for at least the past 15 years that I know of. And in her having that disease, she took sick recently, past 5 years ago. And I brought her here to live with me, to take care of her. And while doing that, I became the person that made her food, fixed her meals and everything. And she was on diabetic medication. And within 6 months of me zoning in on what she was eating, changing the things that she was eating, in 6 months was able to get her off that medication. Do you understand? In 6 months, I made a choice that I did not want to have my mom in the state that she was in on another pill. So I changed what she was eating. I ensured that she got a little bit of exercise in there, and we went to see the doctor, and the doctor was like, wow, her numbers look great when they did her labs, and they took her off the medication. She had been taking this medication for at least 10 years, been diagnosed for at least 15, okay? So I'm just saying it's a choice, that we do, and we can do some things with the dietary choices when it comes to diabetes, as well as when it comes to high blood pressure. Some of the foods that we eat causes our blood pressure to go up. And if you see me looking down, it's because I'm checking my notes. I want to make sure I get all my points across to everyone out there of how we can make better choices so that we don't succumb to this disease. And I know there are people out there that are succumbing to this disease that have none of these underlying conditions, but preventive care goes a long way, that if we continue to try to do better and take care of our bodies, it will go a long way in us not succumbing to some of these diseases, And I just want to say, I know that I've seen in my lifetime that in lower income areas, in minority neighborhoods, we lack grocery stores that have healthy food choices. I've grown up in an area like that, and I see it now to this day. And even past couple of months, like the big grocery store that we had where I was living is gone. I think it went bankrupt or something. Something happened and it left. And we were left with these other not so stores, right? But I go in there with a mindset, telling myself, okay, this is what I have. These are my choices. Let me see what's the best things I can get out of here at the best cost. Because I know there's also an economic factor as to the choices and the things that we eat. If you look at the neighborhoods, you have, especially down south, the Church's chicken, the Popeye's chicken, and other areas in these low-income neighborhoods, you have these Chinese restaurants, these wings and things of restaurants, they're slathered in grease. Sometimes I'm like, you could just throw the whole chicken away because the grease is going to kill you. You're going to have cholesterol knocking at your door every day. You drop a wing in every time. Now I'm not saying we can't do some things in moderation. We can, but making better choices is going to help us to alleviate some of these diseases that are brought on because of the way that we eat. It's just crazy. And I'm just thinking that maybe if they set up webinars and workshops and that are free, that'll help some of the lower income people to be able to make better health choices, because you will do better when you know better. And sometimes people just don't know that there are some things that they can eat that's better, or how to pair the food together so that it makes it healthier for your body. So I'm just saying, one way of looking at this pandemic, looking at how it affects people of color, is we have to make better choices for ourselves so that our body is healthier and stronger to deal with what comes at us. And my next issue, or my next point I wanted to discuss when it comes to, how it affects people of color, is healthcare. Yeah, we don't like to talk about it, but healthcare is a big thing. You have some states that, whether people are working or not, they are covered by healthcare. I'm looking at this country. We're supposed to be like the richest ever country. And we have all of this going on for us. But we do have people that don't have enough money for health care. And that causes you not to be able to go to the doctor when you have an ailment. Because you can't afford that copay. You can't, and if you have no insurance, then you can't go, because that bill alone is going to be $100 and something. I don't know, but I've seen it in my family that the lack of ability to have health care. I've seen it up front and personal, and I know you've seen it too. It's not just a color thing all the time. It's an economic thing when it comes to health care. There are people that don't have jobs, so they can't have health care. And look at us right now. A lot of people are out of work, and you can't just go to the doctor and get seen. And I'm like, not just talking with the virus and how that's going on, but just in normal day-to-day activities. When our life gets back to what we call normal, you can't go to the doctor because you don't have the money to go there. So healthcare needs to be affordable for people to be able to go there. Some people have conditions that they know they need to see the doctor, but the doctor's bedside manner makes them not want to go. I have sat in doctor's appointments with family members, and I have seen that some of these doctors who serve the lower income people, bedside manner is terrible. They don't talk to you like you're an actual patient, like they care, and to think we pay for them to take care of us. So if I'm going to pay the bill for you to take care of me, then I'm going to sit in this doctor's appointment and you're going to listen to the ailments that I have. So you have to make a better choice to be the advocate for yourself. And if you can't really understand what the doctor is saying, take somebody with you. Take another family member with you so that they can be the advocate for you in that doctor's appointment so that you can get served better. And it's unfortunate you have to bring somebody along, but do what you can because it's your body, your choice to live a better life. And I know some of these doctors, they don't listen to these patients. And so that's another thing that makes you not want to go there. So they don't listen to you. They just sit there and look at their little board, their little flip board or their little laptop, and they don't even look at you to see that you are a person that they are talking to. And that deters some people from going. They're like, I don't want to go. They don't even pay attention. They don't know that I'm sitting here looking at them and telling them these issues. You need to advocate for yourself. Don't let them push pills on you all the time unless that's something that you truly need, that your body is lacking in some area and you're not able to just do it on your own and you need to take the medicine. Then yes, research the medicine and then take it. Ask questions when you go pick the medicine up from the pharmacist. They can give you information on it. Okay? Don't just blindly take stuff just because the doctor tells you. Ask questions so you understand. When you leave that doctor's office, you should know why you were there. Were you healed? Is there some way of knowing how to get out of this medication? If I do this, that, and the other, am I going to be able to not stop taking this medicine? You have to advocate for yourself. Some of us go to the doctor and don't even say a word besides, I was good last week, now I'm not good this week. Tell them what's going on with you. They don't know. They don't live with you every day. They don't know. So I'm not going to blame the doctors all the time. I'm not going to blame the healthcare system and the government because they don't, give us all healthcare. I am going to put the blame on us sometimes because, one, you need to vote for the right people to put them in the office so that they can do the things that you want them to do for you. They can be fighting for you for better healthcare, fighting for you from the local level to the top to have better access, because that's really what it is. You need better access to health care, better access to grocery stores to get these things in your life. You have to fight for what you want. And if that means that I have to write a letter to my congressperson, I have to call down to the city council and let them know that I don't have enough grocery stores in my area, but you're sending all of these fast food restaurants, I need a grocery store that's going to have the items that I need in it to keep my body healthy. That's how you're going to fight this corona thing, is by fighting for yourself, fighting for your children, fighting for your nieces and nephews and your moms and fathers and everyone else. You have to fight in order for you to get the things that you need in your family to be healthy. And then we can come above this virus, and not just a virus. When we get back to what is normal or what life is going to be after the pandemic, continue that fight. Continue making better choices for better things that you eat. Continue doing those things. I know for me, I started eating more fruits and vegetables because meat was too expensive. I'm just saying it. Meat was too expensive. So when I do eat meat, it's a bonus. So how about when you go to do your grocery list, you plan it around what you can afford, what is on sale at the grocery store, and Google it. Make meals out of those items that you have. You can eat cabbage without putting any meat in it. I mean, come on. You don't need to slobber it with meat, ham hock or whatever it is. I don't know the meats that you put in it because I just do cabbage by itself, but you get what I'm saying? I want us to come out of this better, because when you know better, you basically do better. I just wanted to take this minute to share some things with you guys about what it is, because this is my vision. This is what I see. When we come out of this and you go to the doctor and you tell the doctor, you take your test and your lab test, and the doctor's like, oh, the medication was really working to help you out. No, doc. I decided for myself to help myself by eating better and doing a little bit more exercise, moving my body. I'm not asking you to jump around and do things, but I was walking while during this pandemic. I was walking around my neighborhood when I could. But when I couldn't, I was in my house and marching in place, doing my body dances. That's what I was doing to stay healthy. Now, let me put a little disclaimer in here, because I'm not a doctor, just a person trying to share a little light and love. If you have a condition that requires you to take medication, and that's what your doctor said, and you've done your research and you know that's what you need to do, continue taking your medication. But ask your doctor. Now, I've been on this medication a long time, and I've done this eating thing, and I've done all these things. Let's take some tests to see what I look like now. Because maybe you can get off that medication or be on a lower dose. But it's up to you to ask the doctor for what you want. And if they don't do what you want, they won't even listen to your request, you might need to find yourself a new doctor. Someone who's going to work with you, not just tell you what to do, but work with you in helping you to understand what's happening in your body. I'm just saying. I just wanted to leave these little tips and notes and share this with you of what I was thinking about when I heard that information, because it made me think, oh my gosh, I couldn't believe that that is what's happening to us. So just wanted to share a little light and love. And remember, you have a choice for the food that you put in your mouth. You have a choice for the medication that you take in some aspect of understanding what it is. So let's continue to fight for ourselves and make better choices for ourselves and our family. Okay? Don't forget to hit subscribe down below. Come back and see me sometime. I upload on Wednesdays. Just want to share a little light and love and hope you have yourself a light and love day. Thank you. Bye-bye.